Imagine this for a second. You're just relaxing, maybe in your garden, maybe setting up your tent at a campsite. It feels peaceful, right?
Yeah, totally.
But then your dog's sniffing around, happy as can be, and, well, there could be something lurking nearby, something really, really dangerous for them.
That's exactly right. And that's what we're digging into today on the deep dive. It's a surprisingly common threat. Metaldehyde poisoning. It mostly affects dogs, but, cats could get into it too.
Metaldehyde. Okay, that sounds pretty chemical. Not exactly something you'd expect in the garden shed. What is it?
Well, in simple terms, it's a chemical compound. If you want the technical bit, it's a polymer of acetaldehyde.
Okay.
But where you'll mostly find it is in slug and snail baits, the pellets gardeners use.
Ah, right. Got it.
And sometimes, less often, it turns up in, like, solid fuel tablets for camping stoves.
Okay. So the mission for this deep dive is really to understand this stuff better. We want you, the listener, to know the signs, understand the risks, and crucially, know how to prevent this. And all this comes from digging into the expert veterinary literature.
Exactly. And the scary thing about metaldehyde is just how fast it hits and how severe it can be. Vets sometimes call it the shake and bake toxicant.
Shake and bake. Wow, that sounds, yeah, ominous. Why that nickname?
It's because the symptoms come on so quickly, usually within like 4 hours of the pet eating it.
Mm-hmm.
And the classic signs are these really intense muscle tremors, seizures, and a super high fever.
Fever. How high are we talking?
Dangerously high. We call it hyperthermia. It can shoot up to 106 degrees Fahrenheit, sometimes even higher. So yeah, shake for the tremors and seizures, bake for the fever.
Right. That really paints a picture. So what are the very first things someone might see? The initial warning signs.
Okay, so early on, you might notice your pet seems really anxious, maybe restless, just can't settle.
Mhm.
Then you might see excessive drooling, that's salivation and maybe vomiting or diarrhea. Also, their heart might be racing, that's tachycardia, and they could be breathing really fast, which is tachypnea.
Okay, so a lot happening pretty quickly. And what if it progresses? What comes next?
Yeah, it can get worse fast. The physical signs become much more obvious. They might start stumbling, looking uncoordinated. We call that ataxia, like they're drunk.
Oh, wow.
And then those muscle tremors get way more intense, often escalating into full-blown seizures. And the really bad part is these seizures can become continuous if they're not treated right away.
Yeah.
Very hard to stop.
And you mentioned neurological signs too. It's not just the physical shaking and stuff.
No, absolutely. Neurologically, they can become hypersensitive. Like even a light touch or a noise might make them jump or react strongly. That's hyperesthesia.
Okay.
They might also seem depressed, sort of out of it. You can notice their pupils are really wide, dilated. That's hysteresis. And with cats, especially, you might see their eyes moving rapidly back and forth involuntarily. That's called nystagmus.
It's just wild how this one chemical can cause such chaos. Can we get into the how does metaldehyde actually do this to the nervous system?
Yeah, it's actually pretty specific how it works. Once it's ingested, it gets into the bloodstream and passes really easily into the brain. It crosses the blood-brain barrier, no problem.
Right.
And its main target is a neurotransmitter called GABA,
Mm.
gamma-aminobutyric acid. Think of GABA as like the brain's natural brake pedal. It calms nerve activity down.
Okay, so it's an inhibitor.
Exactly. Metaldehyde basically interferes with GABA or
Yeah.
reduces its effects. So it's like the brain loses its brakes, everything speeds up, neurons start firing uncontrollably.
And that leads to the tremors and seizures.
Precisely. It's uncontrolled electrical activity, essentially.
Okay, that makes sense. Now, are there effects beyond that initial, really intense phase? Say the pet survives the seizures. Are there longer-term worries?
Yeah, that's a really important question. While the immediate neurological stuff is the most dramatic, there can be delayed problems. One big one, particularly in dogs, is liver damage, hepatotoxicosis.
Liver damage.
Okay. Especially if they ingested a lot of the bait. So even if they seem to recover from the seizures, their liver might still be affected days later.
Good to know. So ongoing monitoring is key then.
Definitely. And another serious complication can arise from the initial crisis itself. The really high fever and the intense prolonged seizures can trigger something called DIC,
DA.
disseminated intravascular coagulation.
Yeah.
Basically, the body's blood clotting system goes haywire. It can lead to clots forming where they shouldn't and bleeding elsewhere. It's really serious and can cause multiple organ failure.
Wow. Okay, that really highlights the urgency of getting treatment. So where is this risk highest? Is it everywhere or specific places and times?
Well, the risk is tied directly to where slug and snail beats are used, right? So gardens, yards, around the edges of homes.
Makes sense.
Geographically, you tend to see more cases reported in, like coastal areas or low-lying regions, places where slugs and snails are just more common.
Right, wetter climates maybe.
Exactly. More slugs, more bait being used.
Okay, so let's say a pet owner suspects their dog or cat got into slug bait. How does a vet figure out if it is metaldehyde?
That's a good point because, honestly, there isn't one single fast blood test that just screams metaldehyde poisoning.
Ah, okay.
A lot of it comes down to the history. Did the owner see them eat it? Did they find a chewed-up box? That kind of thing. Plus, obviously, the clinical signs, the animal showing the tremors, the fever, etc.
So it's like detective work, putting the pieces together.
Pretty much.
Mm-hmm.
Now, some blood work can support the suspicion. You might see metabolic acidosis, that's a pH imbalance. You might see high muscle enzyme levels from all the tremors.
Right.
And potentially changes in liver or kidney values, but often those are secondary effects from the hyperthermia and the seizures themselves, rather than direct poisoning effects initially.
Can you actually test for the metaldehyde itself in the animal?
Yes, you can. It can be detected in samples like stomach contents or blood, urine, even brain or liver tissue post-mortem. But, and this is important, the availability of these tests and exactly which sample the lab prefers can vary quite a bit. So the vet usually needs to check with their specific diagnostic lab first.
Gotcha. Now, given those dramatic symptoms, are there other things that could look like this? Other poisonings or conditions?
Oh, absolutely. Differential diagnosis is key here.
Yeah.
Several other things can cause similar signs.
Like what?
Well, strychnine poisoning, for example, that causes seizures too, but they're often more intermittent and can be directly triggered by noise or touch.
Ah, okay. A bit different.
Yeah. Then there are tremorgenic mycotoxins, toxins from certain molds, maybe in garbage or compost. They primarily cause tremors and seizures too.
Right. Moldy food.
Exactly. Lead poisoning can have seizures, but often comes with other signs like behavioral changes, maybe blindness, vomiting, diarrhea.
Mm-hmm.
Zinc phosphide, that's a rodenticide, can cause seizures and hypersensitivity. Bromethalin, another rodenticide, causes ataxia, tremors, seizures, sometimes with a delayed onset. And then you have organophosphate, or carbamate insecticides. They cause seizures, but often with a classic set of other signs: excessive drooling, tearing, urination, defecation, vomiting, sometimes called SLUDGE signs.
Wow. Okay, so the vet really needs a good history and to look closely at the whole picture, not just the seizures.
Absolutely crucial. It helps narrow it down significantly.
So let's say the vet strongly suspects or confirms metaldehyde. What's the treatment plan? What can be done?
Okay, first things first. Immediate vet care is non-negotiable. This isn't something you can wait out at home. These pets almost always need intensive inpatient hospital care.
Intensive care, right. What does that involve?
It's mainly supportive care because there's no direct antidote. So tackling the hyperthermia is huge cooling measures like cool IV fluids, ice packs, fans, sometimes cool water enemas.
Trying to bring that temperature down.
Exactly. And monitoring really closely for aspiration, inhaling vomit, especially during seizures. That's a big risk. Fluid therapy is vital too for dehydration and correcting acidosis. And of course, constant neurological monitoring, watching the seizures, how responsive they are.
Okay. Since there's no magic bullet antidote, what are the main treatment strategies then?
It boils down to three main things.
Right.
First, get rid of any poison still in the stomach, that's decontamination. Second, stop any remaining poison from being absorbed. And third, control those dangerous neurological signs, the seizures and tremors.
Okay. How do you get the poison out?
If it was a recent large ingestion and the pet isn't already seizing badly, gastric lavage, basically flushing the stomach, is often preferred. Or inducing vomiting with specific drugs, emetics, can be an option very early on.
Right, before it gets absorbed.
Exactly. And then to prevent further absorption from the gut, they'll usually give activated charcoal. It acts like a sponge to bind the toxin. Sometimes they might give it with a cathartic, something to speed up passage through the intestines, but only if the pet isn't sedated or at risk of aspiration.
Makes sense. And controlling the shaking and seizures, that sounds critical.
Top priority. Benzodiazepines like diazepam or midazolam are usually the first line for seizure control. If those aren't enough, they might need stronger drugs like barbiturates, propofol or even gas anesthesia to stop severe, continuous seizures.
Wow, anesthesia level.
Sometimes, yes. And for the muscle tremors specifically, drugs like methocarbamol or sometimes guaifenesin can help. Oh, and for dogs with big ingestions, vets might also start liver-protectant medications.
Are there times when you shouldn't do certain treatments? Contraindication.
Yes, definitely. Big one. Never induce vomiting or give charcoal to an animal that's actively seizing or heavily sedated. The risk of them inhaling it is just too high.
Right. Aspiration pneumonia.
Exactly. Also, any depressant drugs need to be used really cautiously if the animal is already neurologically depressed from the poison itself. And anticonvulsants should always be titrated, use the lowest dose that actually works to control the seizures.
Okay.
Oh.
What about after they're stable? What kind of follow-up is needed?
Well, you need to carefully wean them off the anticonvulsant meds, gradually reducing the dose to see if the seizures are truly gone or if they might need longer-term medication.
Right.
And for dogs, especially those that ate a lot, it's smart to recheck their liver enzymes maybe 72 hours after they go home, just to catch any delayed liver injury.
This whole thing sounds so intense, it really drives home the prevention message. What's the best way for people to prevent this?
Honestly. The absolute best way is just don't use metaldehyde slug baits if you have pets that can get to them. Full stop.
Avoid them completely if possible.
Yes. If you feel you absolutely must use them, be incredibly careful. Put them where pets physically cannot reach them, maybe inside proper bait stations or way under dense bushes where a dog can't easily snuffle them up. Okay.
It's worth knowing some baits are dyed green or blue,
Yeah.
theoretically to make them identifiable.
Right.
And some have bittering agents added to make them taste bad, but honestly, don't rely on that. Dogs, especially, will often eat things despite a bad taste.
Yeah, that doesn't seem foolproof. So even with prompt treatment, are there still potential complications down the road?
Unfortunately, yes. We mentioned the potential for delayed liver or kidney problems, sometimes showing up days later, likely linked back to that initial high temperature and seizure activity.
Okay.
Aspiration pneumonia is always a risk after significant seizures or vomiting. That DIC clotting disorder can still develop from severe hyperthermia. And rarely, some temporary blindness has even been reported after recovery.
So what's the bottom line? What's the overall outlook, the prognosis?
It really depends on speed and aggressiveness of treatment. If you get them to a vet quickly and they get intensive care right away, the prognosis is generally good to excellent.
That's hopeful.
But if treatment is delayed or not intensive enough, especially with a large ingestion, then the prognosis shifts to guarded or even poor. Sadly, most fatalities happen within that first 24 hours.
Wow.
So if they make it through that first day, that's usually a very positive sign.
Okay. Well, this has been incredibly informative and, frankly, quite sobering. Just to quickly recap, metaldehyde, common in slug baits, is a serious fast-acting danger to pets. It causes severe neurological issues, high fever, and can lead to organ damage or worse. Prevention is absolutely the best strategy. Avoid the baits if you can. And if you suspect any chance your pet ingested it, get to a vet immediately. Time is absolutely critical.
Couldn't agree more. And, thinking about how common these baits are just sitting in garages or sheds,
Yeah.
it really makes you wonder, doesn't it? What other seemingly harmless things around our homes or gardens might pose unexpected risks to our pets? And what resources can you explore to learn more about keeping them safe from these hidden dangers?